Hello people, in this video we want to look at this textbook of pathology by Harsh Mohan. This book comes with the small review book that you can see here, right? Many students use the review book also. So let's look at these books. First, a quick glance. And then a quick glance of the review book here. Look at the review book. Basically, this will not be having any images, right? One sec. Here you go. So look at this review book. It only has text, no images. What is this table? Major forms of CNS diseases in HIV/AIDS. So what do you know here? Do you know Kaposi sarcoma? Yes, tuberculosis, meningitis, neurosyphilis, okay? Let's just look at a few pages in the main book. What exactly is pathology, guys? So basically pathology is anything that is abnormal, right? So physiology and then you have pathology. Physiology means it's normal and pathology means it is abnormal, right? So here they talk about inflammation, neoplasia, infectious diseases, and let us especially look at, see this, the pathologies of the respiratory system, the pathologies of the eye, neck, ENT system, right? GIT, what pathologies can be there? What can you think about GIT pathologies? Luckily, they have given a detailed contents. Okay, look at this. Do you remember these Crohn's disease and ulcerative colitis and all that, right? So all this comes under GIT. Then you have liver, biliary tract pathologies. What will you have? Hepatitis, necrosis, cirrhosis of liver, right? You can see all that written here. Cirrhosis of liver. What pathologies do you expect in the kidney, guys? Nephrolithiasis, hydronephrosis, and all that, right? Okay, then coming to skin, what and all you have? Breast, very important for exam, right? You should know fibroadenoma, phylloid tumor. Yes, these you should know. These are all benign conditions. Carcinoma in situ and invasive breast cancer, you should know them. These are all malignancies, right? Then coming to skin, guys, skin you have what common histopathological terms will be there in skin, okay? All that they are covering here. Tumor-like lesions, okay? Look at this directly, you will know. So what and all, you have epidermis, dermis, subcutis, then what else you have? See guys, every chapter finally, it will have some congenital conditions, some acquired conditions, then you'll have tumor-like lesions, etc. So they are having a summary in every chapter, like must-knows they have, which is nice, right? And then what is this? Here they have some clinical case also they have given. And for answers, you have to look at the appendix. And here, what have they given? Review questions. Common warts, psoriasis, lichen planus, rodent ulcer. Rodent ulcer is nothing but basal cell carcinoma, right? So all that you should know. Okay, nevus, and what is a nevus? Nevus is something like a birthmark or something like that, right? It's a mole kind of a thing. Melanoma is something that is increasing in size, or it has come up newly, it is growing, its color has changed. Those will be mostly malignant conditions. A nevus is usually stationary condition. It will not grow or become dark, etc. Guys, in pathology, right, you will have to explain the gross, how it would have changed, the organ, how it would have changed, and how the microscopy will appear. Because microscopy is very important. All the images will look very similar to you. You will have to distinguish them within a minute, right, for your spotters. So look at this gross. They're saying how it shows papillary growth, right, with a pedicle. So this is the pedicle, right? Then what is this microscopy? Microscopy is showing verruca, right? So this is what? This is squamous cell papilloma. Look at this chapter, guys. This is which one? Musculoskeletal system. So what is this? They're talking about gouty arthritis. So they're showing an amputated big toe showing gouty nodule. Wow. And inside it, what is there? Gouty trophies showing central aggregates of urate crystals. So this is how a gout will look, right, under the microscope if you look. Did you understand, guys? What are we looking at today? We are looking at this book, Textbook of Pathology by Harsh Mohan. So this is one of those books that you can read for your pathology. Otherwise, you can consider Robbins. Look at nervous system. So central nervous system, what and all normal they will explain, and then they will come to pathologies, right? And what is this pathology? Neurocysticercosis. Okay. And in this microscopy, they are saying you can see the parasite of cysticercus. Wow, in the brain. Can you see this parasite of cysticercus? Interesting, right? This is the appendix, right? They are giving the answers to those questions that you saw at the end of every chapter. Have you heard of pathological laboratories, right? There they will examine all this. Let us say they will examine the alcohol content, right? Conventional, should there be no alcohol? But if somebody is drunk, then how much alcohol will they be? So mild to marked intoxication is like 80 to 200 milligram per deciliter. Severe intoxication is greater than 400 milligram per deciliter. This is important for your forensic also, right? They will ask you, how will you tell this person is alcoholic? So you check the blood alcohol level. If it is less than, if it is negative, then it's normal. It's conventional. Otherwise, if it is 80 to 200 mild, okay, you got it. So like that, calcium levels, cholesterol levels, all the levels they have given here, right? It's kind of a handy table if you see. What do you say, guys? So that's it, guys, in this book, Textbook of Pathology, Harsh Mohan, right? Do you want to look at the review book a little in detail? Let's look at it. Looks like they are giving some MCQs also in this book. Nice, right? In this review book, quick review book. I think these are really easy questions. Structure of DNA was described by Watson Crick, right? That's what I remember. ABO blood group was given by Karl Landsteiner, right? Let's see, answer for 2 and 3. Which are we looking at? Yeah, they're telling the answers in full detail. Karl Landsteiner, Watson Crick, yes, nice. Look at this, autoimmune diseases. Normal immune, autoimmune, okay, immune tolerance, pathogenesis of autoimmunity, types of autoimmune diseases. You have specific diseases of the organs, then you have non-specific. Non-specific, can you name a few? What is this table here? Hypersensitivity reaction, type 1, type 2, type 3, type 4, hypersensitivity. Type 4 is the delayed type, right, guys? Actually, they have given images also. This is the invasion metastasis cascade. So how metastasis occurs, right? So there is clonal proliferation. Tumor cells are getting loose. They are degrading the ECM. You see here, what was there on this side has successfully reached the other side. I mean, just a way of explaining how metastasis occurs. But anyways, it will reach another place and start proliferating there. So a lot of information is there, guys, in a handy book. If you want, you can look at this book. There we are, done with this pathology quick review and this big book. We are done with the review of Textbook of Pathology by Harsh Mohan. Bye-bye.